Hi, everybody. Welcome to our dry eye webinar. Thank you for joining in. I'm your host, Vanessa Poulain. I've been working as a business development partner at iMed Animal Health for about a year now. My background is in microbiology, and I also have an MBA. As you can see, my email is on the screen. If you have any questions, please feel free to contact me. Now, who is iMed Animal Health? So iMed Animal Health, we've been in both the veterinary and eye care market for over 30 years. It's pretty funny because we actually test all our products on humans before testing them on animals. So as you can imagine, all our products have human quality standards. And we offer products for ocular hygiene, tear stains, dry eye, and ulcers and abrasions. We are a small family-owned business based out of Montreal in Canada, but our products are actually available all over the world. So to get your CE credits for this webinar, you actually have to go in resources on the Animal Health website where you can go register, which is probably already done, but you also need to go answer a little quiz of about 5 questions, and I'll be able to send you your certification afterwards. I also want to take the time to introduce our host, our speaker today, Dr. Caroline Brookfield, who has a very impressive and diverse career background. She holds a DVM from the Ontario Veterinary College, which she obtained in 1997. She currently practices as a small animal locum since her career started 24 years ago. She's gained experience in teaching, research, zoo and wildlife medicine, technical writing, communications, and much more. As you will see during the webinar, some of Dr. Brookfield's interests are obviously public speaking and communication. She currently lives in Calgary, and due to COVID, all her lectures go unheeded by her 2 teenage sons, her husband, and of course, her dog. Thank you so much for being with us today, Dr. Brookfield. I'll let you continue and share your knowledge on dry eye.
Thank you so much, Vanessa. I'm so excited to be here, and I have really enjoyed the journey with iMed to learn more about their products and find out all the great things they're doing at the company. So today we're going to be talking about dry eye. In veterinary medicine, we often call this KCS, or keratoconjunctivitis sicca. And what we're going to explain today is a little bit about dry eye and the different types. We're going to go through some case studies because that's way more interesting. And we're going to talk about some of the diagnostics that are important in dry eye, and then as well, of course, the treatment. So, cry me a river. My kids also don't like when I sing. I am not a very good singer, and I am unfortunately going to subject you to some songs throughout this webinar to make it more interesting. Why do we need tears? Well, if you haven't noticed, a healthy eye, the cornea, does not have any blood vessels. So the tears are important because they actually bring all the oxygen and nutrients to the surface of the cornea and the eye. We all have seen those pets who have very extensive vascularization on the cornea because of some type of disease process, and that's because the tears aren't bringing the nutrients and oxygen that it needs. So tears are very important for the nutrients, also to help see clearly and to wash out any gunk that gets in there, like that darn cat hair that always seems to get in there. If we have an imbalance of the tear film, we obviously get irritation of the cornea and conjunctiva. We can get infections, which can unfortunately also lead to ulcers and blindness. Tear film is made up of 3 different components. So there's the mucin layer, the aqueous layer, and the lipid layer. And there's also the lacrimal glands and the meibomian glands. In humans, it's interesting, the meibomian glands are often one of the structures really implicated in dry eye disease, but we don't know about it as much in animals. So what do the tear film do? So the outer lipid layer is made by those meibomian glands, and it prevents the evaporation of the tears. So you kind of think of it like a glass of water with some olive oil. So we're going to bring this glass out a number of times. The lipid layer is like a thick layer of lipid to keep those aqueous layers in on the eye. The aqueous layer is made by the lacrimal gland, and it produces the third eyelid produces about 40% of the tear film. And as the nictitans, or the third eyelid, goes back and forth across the cornea, it helps to distribute that aqueous layer. It's the largest portion, and it's aqueous, so which means like water. I don't know what the true definition of aqueous is. That was 21 years ago. So the last layer is the mucus layer, which is made by the gallbladder cells, and that helps to stabilize the tear film and actually helps the tear film stick to the surface of the eye. It also protects against microbial invasion and protects the underlying epithelium. So those are the three parts of the tear film. And for the anatomy, obviously there's the lacrimal gland and the meibomian glands we talked about. There's also the lacrimal puncta, where the tears will drain in through to the nasal punctum out the nose. If you've ever done a fluorescein stain on a dog and you see green coming out the nose, obviously that's because it's coming down to the nasal punctum. So functionally, these three layers are important because the mucin layer, like I said, attaches the film, tear film to the eye. The aqueous layer is what contains the water and the nutrients to nourish the eye. And the lipid layer is that layer, like the olive oil on the water, that helps to keep everything in the eye. Otherwise, it'll just evaporate. Heaven knows the tears are not enough. Now, my Canadian friends will know this song, but the rest of you and the rest of the world may not know this song. This was the song way back when with the Africa Appeal, and that was the Canadian stars that got together. So when are tears not enough? What is dry eye? Well, in humans, they've done a huge, extensive review and put a document together called the TFOS-DUES-2. And that goes through all of the different reasons and mechanisms for dry eye disease in humans. So if you're really interested in this or you're having trouble sleeping, then I would definitely recommend this document. There are two main types of dry eye disease. There's a quality problem and a quantity problem. If you have a quality problem, it means that you're not making the right type of tears. They're not functioning very well. If you're making a poor quantity of tears, you're making not enough. Tears are not enough in that case. We're getting lots more information about the treatment and diagnosis in humans, and that's also helping us with animal treatment of dry eye disease. I don't know how to sing, I'll dry my tears. I don't remember how that song goes, Etta James. But what is dry eye? So keratoconjunctivitis conjunctivitis, KCS, is the typical word that I see used among veterinary medicine professionals to describe this condition. So KCS is inflammation of the cornea and conjunctiva, which can affect the quality of the tears and also the amount of tears. Dogs are the most prevalent in this case. Cats who have recovered from herpes virus can also get dry eye. I find that we focus mainly on aqueous deficiency. So those are the dogs with dry eye, with the goopy eyes. But what I hope that you'll learn about today, if you don't know it already, is that evaporative dry eye is also possible. And when does that happen and why does that happen? And what can we do about it? We all know there's a breed predisposition. Like, come on, pug's number one. I had a client that was a pug. He was so funny. He had an ulcer and we treated it, and he would not go to bed until the owners put in the drops. He self-medicated by jumping on the dining room table and waiting there until they gave him his drops. And then when his eye thankfully healed, they took off his cone and were excited that everything was was healed. But the pug was not happy. The pug wanted his cone back. He loved his cone so much, they had to go to a pet store and find like a fancy cone to put on him for special occasions, because I guess it felt so good to treat his ulcer. So pugs are predisposed, any of those brachycephalic breeds are predisposed to dry eye. And here's some pictures of dry eye disease. So, and what can happen in early dry eye is you don't see that typical yellow, goopy, mucopurulent discharge, but you could see things like excessive tearing. You could see just a red eye. Maybe you think, oh, maybe it's allergies or something irritating. Sometimes the crusty nostril, because we're not getting that fluid into the nasal punctum, but also neurogenic KCS can cause that crusty nostril. Clinical signs like pawing, rubbing their eye, squinting, excessive blinking, and a little bit of pigmentation of the corneal surface. Obviously, ulcers and abrasions can be a part of that as well. So what causes dry eye? Our favorite thing, idiopathic. I know it's idiopathic. I call it idiopathic. Immune-mediated conditions that damage the tear-producing glands are very common. Other things can be any iatrogenic, I'm the idiot today, iatrogenic causes such as surgery, antibiotics such as TMS. It's also congenital conditions and infectious diseases like canine distemper virus, and then other conditions can cause a secondary KCS, including a neurologic form of the disease. So let's get into the fun part. Let's talk about a case study. I find it so much more interesting to talk about a case study than just to talk about bullet points. So I hope you enjoy this too. So this is Max. Max is a sweet 5-year-old male neutered Boston Terrier, and his mom, Mrs. Jones. Oh, yeah, there she is, Mrs. Jones. She complained that he has been squinting for the past week and he's been pawing at his eyes since yesterday and they seem a little red. He's got no previous health issues and otherwise seems fairly healthy. So when you do a physical exam, you find that he's got some keratitis, he's got a dull and dry cornea on both eyes, he's got some mucopurulent yellow-green discharge from his right eye, his nostril's a little bit crusty on the right side, and he's getting some pigmentation on his cornea. But he's lovely and he's so sweet. He's tired of me, apparently. He's yawning. So what do we do for Max? Well, I hope one of the things that you're considering is a test for dry eye. So the typical test, or the most common test to test for dry eye disease and for tears, is called the Schirmer tear test. That's the thing where you fold the thingies and you shove it in the eye and then you wait 60 seconds and hope that they keep it in their eyeball for 60 seconds. And it's a bit of a doggy rodeo. So that test has been around and it's the gold standard for testing dry eye. There's a number of categories in that test. So you can have normal, from early to severe KCS. IMED has developed an amazing 5-second test. Can you believe it? 5 seconds. So this test is called the eye tear test. And you can see it here. And there's a few interesting characteristics about this. So one strip does both eyes. There's a left and a right. And you'll see the holes on there. So the important thing is not to cover the holes with your finger because that will affect the capillary action. And so basically you can take this and you do not put it in the eye. All you need to do is find the tear meniscus, which is where the lower lid meets the cornea. It's important not to touch the lower lid. You can touch the upper lid, but the lower lid you need to keep in the same spot so that it creates that tear well. And you put it in for 5 seconds and we'll show you a video on how that works. This one, it's either you got it or you don't. My favorite, black and white. More than 8 is adequate, less than 8 is inadequate. So let's see a video of this test in action.
So here's the video on the IMED eye tear test, which is the awesome 5-second tear test I was talking about. You have to wash your hands like this, by the way. It's very important that you wash your hands like the hand model. Make sure you open it in a sterile manner. You don't put your greasy fingers all over the ends. And then, like I said, the main thing is not to cover those holes on either side of the center with left and right. That will interfere with the test. So here is a very cute little doggy who we're doing that test to. You can see that the tip is going just in that tear meniscus. It's not really touching the cornea. It's just sitting in that spot there for 5 seconds. And it's important not to touch that lower lid. This does have a bit of a learning curve, but what you want to do is mark when you're finished where the line got to. And 8 and over is normal and 8 and under is abnormal. There's no range of like early and late. And obviously you do this to both eyes. This is a great screening test for those predisposed breeds.
Again, Vanessa is here and she provided her email at the beginning and she'll provide it at the end. And if you have questions about anything technical, then she's your go-to person for that. It's a small family-owned company, so you're going to be calling Vanessa or emailing Vanessa, not some random technical service person. Other tests, so we did the eye tear test. Now this test is something that you might not know about. So if you do, then ding-a-ling-ding, you are on track to be an expert in ophthalmology. This is called the tear breakup time, and they do this a lot in humans with fancy equipment. And what the tear breakup time does is it helps to see whether the quality of the tears is there, because you can have some tears, but not actually have them functioning very well. And so this test is when you just take a fluorescein stain, however you like to do it. You know, I just wet the stick and stick it in. Some people like to put the stick in a syringe with some saline. Of course, make sure that that's done like for every patient. I've worked at some clinics where they grab it out of the fridge and I'm like, I don't know how long that's been in there. So make sure you draw it up fresh every time. And what you do is a fluorescein stain like you normally would, which I'm assuming you probably do in these cases anyway. And you like let them get the fluorescein stain on their eye, and then you hold the eye open just like that. And then you watch. And what you're watching for with a blue light and with an ophthalmoscope ideally is for when you start seeing little islands appear. So you can see in this photo here, courtesy of Dr. Sapienza, that you start seeing little dry spots appearing in the cornea. And so in a normal dog, that should be more than 20 seconds. And this is a test, again, that you're doing that fluorescein stain anyway. So you might as well do this test to see what the character of the tears is like. Okay. So what kind of tests are we going to want to perform on Max? Well, obviously, we're going to want to measure his tear volume, I hope. And his eye tear test was only 5 millimeters, which is low. And his Schirmer tear test, because you're not used to the eye tear test, you did both. I know how it works. His Schirmer tear test was 8 seconds. We're probably going to want to do a fluorescein stain, and we may want to do an intraocular pressure. We're definitely going to want to do an eye exam to look for dystichia or any foreign objects or any issues that might be going on in the actual conjunctiva or tear or on the cornea. And we can do that tear breakup time test because it's simple. You're staining the eye anyway. So his tear breakup time is 24 seconds. In dogs, anything over 20 seconds is normal. Now, for the purposes of this case study, we gave him 24 seconds because we want to focus on the qualitative versus the quantitative, but it is very, very common for dogs to have a quantitative dry eye, which is the typical KCS, he's not producing enough tears. It's very common for the breakup time to be also very low because it's a deficiency in all of the layers of the tear film. But for purposes of this webinar and because his symptoms are mild, let's say his tear breakup time was normal. I'll dry my tears. I don't know how to sing that song. So for Max, we're going to diagnose Max with dry eye disease. He's specifically deficient in the quantity of the tears he's producing because his Schirmer tear test and his eye tear test were low. He is deficient in the production of his tears. The tears themselves seem to be okay. He's just not making enough of them. Yeah, that's you, Max. So let's talk about a different dog now. Let's talk about Roxy. Roxy is a very, very spoiled little female spayed Maltese who's 4 years old. Mrs. Jones is very worried about Roxy's eyes, and she has been. The only real problem Roxy's had in her life so far has been a little ear infection. Despite that, Mrs. Jones brings Roxy in 3 or 4 times a year, often to complain about the tears. And you feel a little stuck. So finally, after you watch this webinar, you're going to go back and see Roxy with a whole new set of tools in your toolkit. She has these chronic tear stains and she excessively tears. So what do you need to know about Roxy? Well, of course, in every animal, you're going to get a history, but with Roxy specifically, we're going to want to ask a lot more questions about the environmental factors. Is she a junkyard dog? Does she live in a dusty or dry environment? Is she running through the fields every day? Is she having allergies? Is there smokers in the home? Or sometimes I ask about scented like plugins and things like that. So finding out if there's any kind of irritant in her environment. Also going to want to measure her tear volume, which in her case with the eye tear test was 12 millimeters, which is an adequate amount of tears. We're probably going to want to fluorescein stain her eyes if Mrs. Jones is worried. We can also assess the viability of that nasal puncta. So when we put the fluorescein stain in and we try to rinse it out, we can watch and see if it comes out the nose, which kind of tells us if the nasal punctum is patent. We might want to do an intraocular pressure and an eyelid exam just like we did in Max. We did that total tear breakup time with Roxy, just like we did in Max, but hers was only 10 seconds, which is interesting because she has so many tears it was interesting to see that the breakup time was so fast. So we're also going to diagnose Roxy with dry eye disease. She has enough tears, but she doesn't have the quality of there. I'm trying to remember how this song goes. Oh, you know you're gonna cry, cry. And Roxy is crying. And Mrs. Jones is also crying, but she's just like, what? Roxy has dry eye disease? Are you kidding me? Roxy has dry eye disease because her quality of tears is not there, despite crying a river and having tears overflowing and staining her face. So let's review. Max has a low aqueous layer. So his aqueous layer is inadequate. He's not producing tears, and his tears are not enough. Roxy has lots of tears. Her problem is the tear quality is very poor. So one of the ways to think about how Roxy's eyes are a problem is if you think about this olive oil idea. So Roxy is like a glass of water. Wrong glass. Roxy is like a glass of water. And she does not have an adequate amount of the oil layer to keep the tears in the eye. This is what Roxy needs. Mrs. Jones is dubious. She's not sure about why Roxy might need extra tears because she has tons, thank you very much. But she needs that lipid layer to help prevent the evaporation. She's also going to need some support with her mucin layer so that those tears can actually stay stuck attached to the eye. So the part that everybody's waiting for, this is the cliffhanger. This is page 67 of the movie script. Did you know that if someone's reading a movie script, they flip to, I don't know if it's like page 67. On every screenplay, the action happens on page 67. I thought that was interesting as a little aside. What do we want to do for a dry eye? Well, we need to replace the tear film if it's not there. We need to stimulate more tears if we can. We want to control secondary infection. We want to get rid of that goopy eye and that really conducive area for bacteria formation. We want to remove excess mucus, and we want to help modulate any immune-mediated inflammation, because remember, that's one of the main causes of dry eye disease in dogs. So cyclosporin and tacrolimus are the standard of care for treatment of dry eye disease in dogs, especially when we're talking about quantitative dry eye disease. So cyclosporin and tacrolimus, they stimulate tear production. They suppress that immune-mediated inflammation. It's very effective in many dogs. It's the standard of care for treatment. Challenge is it can be hard for people to apply. It can sting, and it's effective in the very early stages, but it can take a few months for the effect to kick in. It can be expensive, so owners are looking for alternatives and also something to bridge that gap from the treatment to when treatment's starting to when it actually starts taking effectiveness. The other thing that's important to know about Optimune is that it's important to clean the eyes before you put those in. It says in their product description that you don't want to just like put the Optimune on like a gunky eye. So we want to make sure we're cleaning that eye to get rid of that mucus and debris. And we want to make sure that it's a clean eye that we're putting the drops into. And we might want to add lubricating drops to the protocol to make it more comfortable for the pet. So Optimune does not replace the tear film, but it stimulates tear secretion and modulates immune-mediated inflammation. So what can we do about controlling that secondary infection and removing that excess mucus that we need to do? Artificial tears. Yes, Roxy, for you too. So what is a healthy tear film anyway? So a healthy tear film has a plasticity, and it's got a change in the way that the drop characteristics act when we're blinking. So when we have our eyes open, our tears have a very high viscosity, and that's good because it stays on our eye. When we blink, it lowers the viscosity, and that helps it, flow into the lacrimal ducts, and it also helps us to return that elasticity when we open again. So when your eyes are open, there's high viscosity, and when we close them, it's a low viscosity. And you can see if we're looking at an unhealthy tear without lipid or one with full of water, it has just a low viscosity. So it just ends up like flowing out. It doesn't have that ability to stay on the eye when the eyelids are open. So what are viscoadaptive tears? Close your eyes. Let me tell you all the reasons why. What is it? You're never gonna have to cry. Oh, that was really bad. Okay, so I obviously need to practice my singing, but Michael Bublé is an amazing singer. I just wanted an excuse to listen to him sing. Viscoadaptive artificial tears. You don't need to cry. Let me tell you all the reasons why viscoadaptive tears are helpful. So they refresh and stabilize the tear film, and they reduce tear evaporation because of that viscosity when you open your eyes. If your drops are too liquidy when you open your eyes, they're just going to evaporate. They will stay on the cornea for a long time, and they've got that blink activation. So when you open your eye, it's cohesive, and when you close it, it's dispersive, which is that thick and thin idea. The other thing that's helpful in an eye drop is hyaluronic acid. And so that helps keeps that moisture on the eye so that that aqueous layer can stay active and efficient. One of the things to ask about when you're getting drops is if they have hyaluronic acid, what's the quality control? Do they use medical grade hyaluronic acid like iMed does? Is it a cosmetic grade, which can have more impurities and more contamination? And sometimes you can find out the percentage. The percentage can be misleading because if it's a high percentage, but it's a poor quality, or the chains are not a good type of chain, then it might not be as effective. But those are some of the questions to ask when you're using an artificial tear. Are they viscoadaptive? Is there hyaluronic acid? Is there glycerin, which we'll talk about in a little bit, and some other questions. So we want to replace the tear film with something that actually works. Hyaluronic acid, even better than the real thing. And I actually saw U2 in concert, so I don't have to wonder about how to sing this song. It's even better than the real thing. I don't know if that's true. This is just a song. But what we want is something that's going to refresh and stabilize the tear film. We want something that's going to stay on the cornea, so when you open your eye, it's going to become cohesive, so it's not going to just evaporate off your eye. So let's watch a little video about hyaluronic acid. So this is the hyaluron molecule in here. And we've got the glycerin and the phosphorylcholine. If you have questions about that, please email Vanessa. Look at her makeup, so beautiful. I would never put eye drops in an eye like that, but you can see when she blinks, the lipid layer or the tears disperse and get thinner. And when you open the eye, you get that expansion, and then it sucks in all the water to keep your eye healthy and moist. So the product that iMed has for pets for replacing replacing tears is the eye drop vet gel. It says a gel, but it's really liquid. And the eye drop vet gel has all the properties that we just discussed. It's viscoadaptive, it contains glycerin, it contains hyaluronic acid of a medical grade, and it has that blink activation of that cohesive and dispersive properties. It's a fantastic product, and it's got some great innovation, which I'm going to talk about in a second. If you're in clinic already, you might be using the Eye Drop Vet Plus product. Now, we're not talking about that product because we prefer Eye Drop Vet Gel. The plus is a little bit misleading. The plus means it has a preservative. And so you can still use that product, just a little bit cheaper, but we don't recommend it. Preservatives can be quite drying to the eye. And what can happen is if you use an eye drop that has a preservative, then you're going to get temporary relief, but that preservative might cause more drying. So then you have to feel like you have to add more drops. So you get into this cycle of adding drops that are somewhat drying, and then there becomes an effect where you can end up doing more harm to the tear film by using something with a preservative. So we would prefer everybody to use the Eye Drop Vet Gel. This one has no preservative. It's got the hyaluronic acid and glycerin at 0.3% of hyaluronic acid, which is also higher than the Eye Drop Vet Plus. And it has no preservatives. And this is the product here. And the great thing about this product is it has this really bizarre little tip to it, which we're going to talk in a minute. But these are the eye drop vet gel product. This one with the kind of blue label, the greenish label is the one with the preservatives in it. Both products, however, contain ingredients that help to support all 3 layers of the tear film. So the glycerin helps with the lipid layer. Now remember, the lipid layer is the part that keeps the water, the aqueous layer on the eye, from evaporating. So the glycerin is there to help the lipid layer. The hyaluronic acid is there to grab all that water 1,000 times its weight and keep the water in the aqueous layer. So you could have all the hyaluronic acid you want, but if you don't have that glycerin to help stabilize the lipid layer, it'll be more likely to evaporate. The mucin layer is supported by HA binding sites. And so the increase in the HA binding sites, the HA binds to the mucin and helps keep the tears on the eye. So this is how mucin and hyaluronic acid help to stabilize all 3 layers of the tear film. So now we talk about the innovation, which I think this is the coolest thing. So when you first open this package, you're like, what? What's that thing? It doesn't have the long pointy tip that you're used to. That long pointy tip, if you've ever used that, when you squirt a drop out and you let it go, it sucks all the other drops back in again. And how many times have you had a client that brings in their box of medications and you find like a bottle of tobramycin from like 1998 and they were like, well, I had this at home, so I thought I'd use it. Oh my gosh, are you crazy? It's probably full of Pseudomonas. So not that you would use this if it's as old as 1998, but the great thing about this product is that it has this one-way valve. So it has no contamination. It also has silver impregnated lid to discourage contamination, which makes it, we can use it, they can make it preservative free, which is so important because you can't overdose this. You can't add too many preservatives with this drop that will cause more drying than lubrication. So I'll show you a little demonstration here. Hopefully it's in focus. So there's like some liquid on there. So you're going to drop out the drop as usual, but you can see that drop hanging there. I've released the pressure, but the drop is still there. Hallelujah! It's not going to suck up all the Pseudomonas on my finger. But you know what else we're going to do? We're going to shake it off. Shake it off. Shake it off. Shake it off. You thought I wasn't going to sing on the slide because there's no song title. You were wrong. So you're going to shake that off and then put the lid back on. And so I've got that drop on my finger still, and I'm going to rub it in. If you have your samples, so an aside we didn't mention already, for joining this webinar, if you give your information, we can send you some samples of these products. If you have your samples, join me. Don't save it for that miracle dog. You know it's going to sit on the shelf. Try it with me. So you can put it on your fingers and you can feel how slippery it is. Just imagine, it's very slippery. That's the hyaluronic acid that's keeping that lubrication in there and the glycerin. So the advantages are no preservatives. That's huge. The special one-way valve, so people who always touch their eyelid drops to their lids, which they're not supposed to, if they do, it's going to be less likely to get contaminated. We've got that high molecular weight HA that's medical grade and it's viscoadaptive. So when you open your eyes, it gets thick. And when you close your eyes, I'm going to tell you all the reasons why it's important that the tears get dispersive. I don't know if you can make that rhyme. Okay, so what ingredients are important for each patient? So for Max, and like the tears are great for all 3 layers of the tear film. But just to review, the aqueous deficiency is really helped by the hyaluronic acid because it absorbs 1,000 times its weight in water, and it's the aqueous or watery part of the tear film that Max is really deficient in. With Roxy, poor Roxy, she doesn't have her olive oil. She's like a glass of water with no olive oil, just baking away in the Tuscany sun. We don't want Roxy's eyes baking in the Tuscany sun, so she needs more lipid, and the glycerin helps with that. And the hyaluronic acid also helps with the mucin, with the binding sites to keep the tears there. So Mrs. Jones is like, okay, that's great. What do I do about the tear staining? She really cares mostly about the tear staining, and she has a lunch with her lady groups after COVID, and she wants to make sure that Roxy is looking her best. And what do we do about facial fold odor? Because I hate to say it, Max, but I'm pretty sure there's some stinks in that fold. What do you tell Mrs. Jones? She's been asking you about these eye drops or the excessive tearing for years. And if you're like me, I'd be like, I don't care about tear stains. But actually, I have my own dog right now. She's an Aussie Shepherd mix, and I always thought she was getting allergies at certain times of the year. She rubs her face on the ground, but I've always done tear tests on her, and I've done, looked at her eyes and taken her to an ophthalmologist. She had episcleritis at one point, and I don't really know the diagnosis for her because, like, often we don't get a full diagnosis. But what I do know is that when my dog gets a little bit of tearing and her eyes get a bit red, if I use the eye drop vet gel, it significantly helps with her comfort, and it significantly helps with her tearing. So I don't even really know what my dog has, which is probably not a great thing since I'm doing a webinar on this topic, but it works. And if I use it for a couple of weeks and then I don't use it again for a couple of weeks and try it again, I don't have to worry that it's going to get contaminated or that I'm going to be putting something harmful in her eye. So back to Roxy. Oh, I can't remember how this goes. Big girls don't cry. How does that go, Vanessa? I'm not going to make you sing. So I keep on thinking big girls don't cry, but I think that's the Beach Boys. That's not right.
It's big girls don't cry.
There you go. Thank you. That's lovely. You're a much better singer than me, Vanessa. So maybe I should get you to sing. We should have reviewed this before we started this webinar. I'll make her sing in the future with me, so you guys don't have to suffer mine. Okay, so a chemical in the eye that causes the tear staining is porphyrin. It's excreted in the tears and saliva, which is why those little white dogs with allergies have those brown feet. Predisposed to excessive tears, excessive licking on the feet. If they have anatomic problems like that, those narrow tear ducts or ingrown eyelashes or dystichia or other types of abnormalities of the eye, that can also cause excessive tear staining. And, it's important to say that you could have a totally normal tear film and still have excessive tear staining because of the amount of tears, like the anatomic changes or whatever. So what is the solution? Whether you've got a dog like Roxy who has poor quality of tears, so we want to address that factor, or whether you just have a dog that's got poor drainage and gets that tear staining. We want to prevent the contact of the porphyrin with the hair. Mostly our little white dogs are affected. So how do you do that? What are most people using now? What are you using now? Most people are using nothing because who cares? Who cares about staining, in my opinion, if it's all it is staining. Some people are using like bleach containing products. Some people are using detergent containing products. My clients will often use just like a Kleenex with some like tap water on there, which is probably not ideal. Okay, so if you have a dog with nasolacrimal duct obstruction, maybe they have an anatomic problem there or some other surgery or something that caused an obstruction, then the tears are going to overflow, even if they're normal tears. They're going to don't stop draining through the puncta, don't stop, they'll overflow. Vanessa, you really have to sing with me. I'm such a bad singer. Okay, so that's one reason we can get the tear staining. The fold odor in those little plugs and those dogs with the folds is usually just because, like anywhere on their body, it's a warm and moist environment, which is conducive to bacterial and yeast growth, and it can get stinky and irritated, and you can get a pyoderma. So how do we prevent this problem versus treating it? Well, the solution is to keep those folds clean, to keep them dry. In some cases, you can do a surgery to correct those deep folds, or you might use like an acetic acid containing solution or medicated ointments, chlorhexidines, like a flush solution. And in some cases, you need oral medications in a severe infection. But one of the options for preventing the nasal fold odor as well as the porphyrin tear staining is this product called Eyelid and Lash Vet. So it is an ocular hygiene care product, and what that means is it cleans the eye. So it comes in two formulas. It comes in the wipes. So this is the bottle for the wipes here, or the tub. And these are excellent because they're already impregnated with the solution, and they're quite moist. So there's lots of product on there, and it's very comfortable for the dog. There's no bleach, there's no detergent. It helps, and again, it's also very lubricating. It is safe even if you get it right in the eye. And yes, ladies, there is a eye, lid, and lash product for humans. It is an amazing makeup remover. So what this does is it helps to remove the bioburden. It gets rid of that gunk that you need to get rid of before you apply the Optimmune, and it has antibacterial properties. It helps to decrease the inflammation that's coming from all that discharge and bacterial growth, because the inflammation actually makes the dry eye worse. In humans, inflammation is really the main cause of dry eye, and they have to address that inflammation in the meibomian glands. And so we can probably extrapolate that in animals there's a similar problem going on. So there's no antibiotics, there's no harsh chemicals. So if you use this every day to clean the eye, as well as your proper treatment for dry eye disease, it will help to restore the corneal health. But the other thing for Mrs. Jones, who just wants the tear stains gone, this will prevent tear staining in those little dogs, even with normal tears. The way it does this is it has it kind of creates a film so that the tear doesn't come in contact. It's not a film you can see or feel, but it helps to prevent that pore film from coming in contact with the hair. The thing to know and to tell Mrs. Jones is this does not remove the tear stain, because it is not a bleach, it is not a detergent, it's a preventative. So if Mrs. Jones is meeting her lunch ladies on Thursday, my suggestion is you can clip the hair in those eyes if she's really bothered by it. Or you just have to wait until that hair grows out, and if you're using this every day, the new hair growing in will not be stained. The tub is great for people who are a bit more frugal, or they want to use their own, like cotton swab or whatever, to clean the eye, and it's a pump formula. So what makes it so great? Borate. And this is an ingredient that reduces the bioburden, and it helps to prevent that porphyrin, and it causes that film on the eye. Because there's no fermentation of that tear film and the fermentation in the folds, it helps to prevent that odor and that infection, and it also reduces inflammation and irritation. It is extremely safe, and you can actually get this in the eye. How many products have you prescribed around the eye that say don't get in the eye? I never do, because I know that clients are really struggling to get things in the eye. I remember my dog, when she needed eye drops once, and I think I had to go out of town, so my husband had to do them, and he went to go do them, and he takes the eye drop, like here's my dog, and he's like coming at, I'm like, what are you doing? And he's like, well, I got to, I'm like, no, it just seems so obvious to us sometimes, but you know, if you could be a fly on the wall with your clients and how they're trying to medicate their dog's eyes, except for my pug client who liked to sit on the dining room table, it might be a quite comical thing. So why would you use this product in our case studies? Why would you use it in Max? Well, in Max, you would use it to get rid of all that mucopurulent discharge, to decrease the inflammation that's coming from all that debris that's building up from the dry eye. You would also use it if you're going to start Optimmune on him, so that you can clean that eye to get rid of all that debris, so that the Optimmune is more effective. And it also restores the ocular health because of that decreased inflammation. And Roxy, you're going to do it not just to give Mrs. Jones something to do, because I know we're all guilty of finding things like that, but this is going to help prevent that tear staining that's bothering Mrs. Jones so much, and it's going to prevent that unsightly staining and odor. So for our animals, for Max and Roxy, I think we've done a pretty good job. Yay us! We've replaced the tear film, and we've replaced the tear film with a product like the eye drop, that gel. We've stimulated the tear secretion, so in Max, we probably would have prescribed Optimmune or tacrolimus. We've controlled that secondary infection, whether we needed to give any other medications, but we're going to control that secondary infection and prevent it from coming back with the eyelid and lash. We're going to remove that excess mucus with the eyelid and lash, and we're going to modulate the immune-mediated inflammation with a product like Optimmune or tacrolimus. Yay! So what if we don't treat Max appropriately? Where did you come from? Where did you go? Where did you come from? Cotton Eye Joe. I always think it's Coconut Joe. I just found out in this webinar it's Cotton Eye Joe. We don't want Max to become Cotton Eye Joe. So what are we going to do for Max? He's already tired of us in this webinar. He's yawning. So when we look at the cornea, we're 3 layers. Everything's in 3s. That's handy for the eye, the tear film and the cornea. So we've got the epithelium on the surface of the eye, the stroma, which is the main tissue that supports the cornea, and the Descemet's membrane. And all I know is Descemet's membrane is bad news if you have an ulcer with a descemetocele. So ulcers and abrasions can involve 1 or all 3 layers of the cornea. Again, if it's involving the Descemet's membrane, After you freak out a little bit, you need to be really serious about treating that, because that means it's one layer away from kaboom. We don't want that. I usually refer those myself. So we got the superficial epithelium, and we got the deep stroma ulcers, which can cause scarring, and then of course the perforation in bad cases. So one of the causes with KCS, inadequate tears, things like foreign objects, chemical burns, entropion, lagophthalmos, which we haven't talked about, which is when dogs are like such genetic miracles that they can't physically close their eyes, so they always have their eyelids open a little bit. Those dogs are very prone to ulcers and abrasions, and so those need to be treated aggressively with lubricating drops to make sure that they're always moist. And it's painful. It hurts. If you ever, so I have a story about working in Australia. I was backpacking in Australia, and I tried to make some money, so I went to work for the local fair. I was a carny, and I sold these fake wigs, and they were like this. I had to wear one, a hideous pink wig, and people would come up and say, I want to buy a wig. And I'd say, really? So I worked there for like 18 hours. I made like 120 bucks. The next day I woke up and my eyes were glued shut. I couldn't even open them. I had to like get someone to help me open my eyes. And I spent $108 at the doctor trying to repair the damage that this fake wig, obviously the product had fallen into my eyes and caused a corneal irritation. It was extremely painful. And I didn't even really have much, I didn't have any ulceration. It was just painful and irritated. So let's make sure that we're addressing the pain in these dogs, because it's quite painful. So we're going to diagnose it with fluorescein stain. And we're going to treat it with like antibiotic drops, maybe some serum, some hydrating eye drops. Some cases need surgery. And one of the things that some people use is a corneal bandage, which is really helpful because it helps to decrease the pain. So Vanessa's got our Vet Shield, the iMed Vet Shield package there. And so iMed has come up with this great technology, which is a contact lens, but it's not like a human contact lens that you've got a size or anything. It is developed specifically for humans, or for animals. It's developed specifically for animals, and it fits dogs and cats. It's a mechanical barrier that protects and relieves the pain of the corneal and when you have an abrasion or an ulcer. The great thing about it is it's collagen based, so it dissolves. And as it's dissolving, it helps to nourish the eye. And the even better thing about it is that aqueous medications can penetrate through it. So if you're using like a tobramycin, or you're using some other type of medication that's an aqueous medication, this doesn't work for ointments, but if you're using an aqueous, it can actually penetrate through that contact lens and still treat the eye. So it protects and it nourishes the eye and gives a lot of pain relief, because we don't want them in pain. They're going to keep scratching their eye and make it worse. We need to make sure the infection is controlled, but you can apply this after a grid keratotomy. So Vanessa is going to show you a little bit in this product, because it's very important that you read the instructions. Now, for all of you technologists watching this webinar, this is what you need to stop your vets and say, have you read the instructions? And they're going to say, yes, I have. And they're going to try and put it in backwards. So Vanessa's going to show you that there's the contact lens there. Vanessa, I'll let you explain it, because you've got it and you know what's going on there.
Okay, so the Vet Shield actually comes in a sterile packaging. As you can see, there's a little well here where the Vet Shield actually comes in, and that will allow you to hydrate the lens, which comes dehydrated with a BSS solution. After you wait 10 minutes for the lens to take its form, it will actually look like a contact lens, like this. And as you can see, this one has a little bit of a sharper edge, kind of like actual contact lenses. So the way it's manufactured, the lens always comes inside out. So it comes inside out, it looks like this with the sharper edges, and every time you need to pop it out. And once you pop it out, you can see you'll get the rounder edges. And that means that it's the right way, and then you can place it in the eye.
Great, thank you for explaining that. And so for you technologists, if it pops out and your vet says, this product doesn't work, you can say, you put it in backwards, and they can say, no, I didn't. And you can say, well, why don't I prepare it for you? And then you can put it in, doctor. Because that's the only trick with this, is making sure you know how to use it. So review the instructions, email Vanessa if you're not sure, or if you're using it for the first time, just make sure you're doing it properly. Always use the clean hands, like in that video, you have to wash your hands like this. And it should be in an anesthetized eye. So, this is not something that you just shove in an eye. It's better if it's anesthetized just because it's more comfortable for the patient. So a summary of the solutions we can use for both Max and Roxy and to make Mrs. Jones happy is the tear test, the eye tear test. So this is a really easy 5-second solution. It's perfect for screening any of those predisposed breeds to maybe having a qualitative or a quantitative dry eye problem so that we can get it before it becomes that dry, ulcerated eye with a mucopurulent discharge. We also have the eye drop vet gel. Just as a little aside, for me, I live in Calgary, it's very dry. There's also an eye drop vet gel for humans. And I use this regularly, especially when I'm on a computer and when I'm feeling like it's especially dry in the summer here. It feels so good. It's such a hydrating drop, and I feel good that there's no preservatives in it. So for the animals, we want this eye drop vet gel. And the vet gel is better than the vet gel plus because of the preservative in the plus, and also the plus has a little bit less of the hyaluronic acid. Remember, this has the really cool technology with the drop and the one-way valve so that we don't get that contamination, that you can shake it off, shake it off, shake it off, and the silver impregnated lid. So you don't have to worry so much about contamination on this. And the great thing about these drops is that even if it's been on the eye for a while, if you have the drops at home and you had them on your finger, like back in the presentation, you might feel that they're a bit dry now. Well, just take some water, and once you add some water, you can feel it getting viscous and slippery again because that hyaluronic acid is sucking up that water. Remember, it's 1,000 times its weight in water. So that's a great product for that. The eyelid and lash is what we use for cleaning that gunky, yucky eye, and it's also what we use to prevent tear staining in those little white dogs like Mrs. Jones, who just wants to lunch with her ladies and have her dog look as good as her. So the eyelid and lash is preventative. It is not a detergent or a bleach, so it's safe in the eye. So for those clumsy owners, you know who you are. I'm one of them. You don't have to worry about damaging the cornea if you get it in the eye. And then lastly is the Vet Shield, which is that innovative product, which is a contact lens made out of collagen that's sized particularly for dogs and cats' eyes, and that helps to keep their eye pain-free when they're recovering from corneal ulcer or from an abrasion. So, in summary, keratoconjunctivitis sicca, or dry eye. It can be an abnormal quantity of tears like Max, or it can be abnormal quality of tears like Roxy. Many dogs with abnormal quantity of tears also have poor quality. So remember that when we have KCS that's a quality problem, it's more needing that mucin and that lipid layer support with the glycerin. When we have a quantitative problem like in Max, we need more of that hyaluronic acid and the HA binding sites so that we increase the aqueous layer and keep that aqueous layer connected to the eye. So the other thing that we need to remember is about the tear staining and facial fold odors and the discharge around the eyes these dogs have. That is a breeding ground for bacteria and yeast, and it causes inflammation. And inflammation in humans is the primary reason people get dry eye. So we need to keep those eyes clean, and we need to keep them healthy and the cornea healthy, and the eyelid and lash product will help do that. And it's safe in the eye, or any other product to help keep the eye clean. But most of those products like the chlorhexidine, the acetic acid, I worry a little bit about those getting in the eye. When you're rubbing up in here on the fold, you want to make sure you're using something that if people the dog moves and gets it in the eye, that you're not going to be seen on emergency with an abrasion. And finally, for ulcers and abrasions, they're painful. Let's give these dogs some relief with a bandage like the contact lens solution. The causes of ulcerations and abrasions are many, including untreated dry eye or KCS. So please don't overlook dry eye, and don't assume that because a dog has a ton of tears, like Mrs. Jones, that dry eye could not be the problem. Maybe it's the wrong name. Maybe it should be messed up tears. I don't know, another word for poor quality of tears. But just because a dog is producing a lot of tears and they have an adequate Schirmer tear test, it could be a functional problem where the tears are just overflowing. But it's really, really important to do that tear breakup time, or to at least consider the possibility that those tears are not effective, because Poor little Roxy. She doesn't have that layer of olive oil on the top of her glass. The layer of olive oil is that mucus layer that helps keep the eyes from baking and evaporating in the Tuscany sun. And I wish this wasn't water in here, and I wish I was in Tuscany, but not this year. So thank you for listening to this webinar. Remember to contact Vanessa or call the 1-800 number if you have questions about the products. If you haven't got your supplies yet or your samples, or you haven't signed up for those, please make sure to reach out to iMed to make sure you get your samples so you can see how amazing these products are. I'm hard to impress, and I really do like these products and think they're very effective. So, and what I love about the company is that they use medical grade products. They have high quality assurance. They're a Canadian company, and they also produce human products, which to me is kind of a cheat as far as quality goes, because if they make it for humans, there's a lot more stringent quality control, I feel like, with human products than with animal products. So I think that's all for dry eye. Don't forget the drops, and don't put a bunch of preservatives in these dogs' eyes because it will make it worse. I think that's it for me. So thank you, Vanessa, for the opportunity to talk about dry eye, and thank you for listening to my songs, because heaven knows the tears are not enough. Okay, that's my last song, I promise.
Perfect. Well, I hope all you listeners learned a little bit more about the science behind dry eye and how to treat it. Thank you so much, Dr. Brookfield, for sharing your experiences and all your knowledge. And please go ahead and answer the quiz to obtain your RACE certification. Also, please reach out to me if you have any questions, and I'll be more than happy to hear your feedback on the products and on the webinar. Thank you for joining in.